back or ankle.
And your ankle? Is it severe?
It's a lot.
It hurts a lot? Can you get up? Do you have capacity to get up? We're gonna help you. You'll be fine.
Just a lot.
You'll be fine. Can you please come right there?
I will try.
Alright, that's good. You're doing fine. Alright, can you sit right here?
Yeah, sure.
As long as you press it right now. Can you sit right there? Alright.
You want light?
Alright, so. Can you please get it? Thank you. Can you keep your leg on me? Okay, can I take your shoe off?
Yes.
Okay, I'm not gonna let it hurt. I'm not gonna let it hurt.
Loosen up, loosen up.
Alright. You're gonna keep it here for now? Just give me 1 second.
Look at that.
So I'm gonna keep eyes on it right now. You feel it a bit cool? How did it feel? Is it too worse or can you bear it? Can you bear the pain right now?
That's a lot. It's not that like not too much, not so less.
Okay, but you can bear it. You can at least bear it. You'll be all fine. You'll be good. Don't worry about it. So right now we are going to keep the eyes, and later once you can stand up, we'll be going to trainer's room, and then I'll follow up with the further procedure. Okay?
Sounds good.
Cut.
Fanshawe College has a trainer's room here, which is located in J1008. This is the place where you usually treat the players who get injured on the field. From the gymnasium, after you give the immediate treatment of ice and everything, you get them to the trainer's room. And then this is more of first aid and precautionary, which you have. This is the icing. You have a lot of ice in here. Usually stack them in the plastic bags right here. Just stack them up and then take it and then use it over the injured part in order to reduce the inflammation. You have different kinds of adhesives for the taping. Taping is mostly for prevention, like preventing injuries. You have different types of tapes in here, like adhesives and removal for the taping. I have different sprays there, and you have different kinds of bandages and crepe bandages in order to reduce the inflammation when there's an acute injury again, or the sprains or strains. And then you have different kinds of bandages here stacked in. You have different equipments to remove the tapes and in order to tie the bandages and everything, like the scissors and stuff. Then we have a medical supply room which usually stacks the most of the stuff, like the bandages, and we also got like a wheelchair and then crutches inside. We usually stack the towels and other kind of equipment for adhesives and other taping equipment. We usually put the cold packs in the fridge. We usually have the cold packs in here. There's a hot pack. There's a hot container which holds the hot packs in it. It's usually for the it's a prior preparation for the players in order to get into the field. It's more like a relaxation. At the same time, it loosens up the muscles in order to give them the resilience in the muscles. We got a whirlpool bath right here. It's more of relaxation. You can set temperatures from extreme cold to extreme hot. Like you can fluctuate the temperatures in here. It's mostly like relaxation for the players after the event.
The immediate protocol we are following in our this treatment rooms is RICE. The R stands for rest, I for icing, C for compression, and E for elevation. So when the patient is coming in with an injury, so we are immobilizing that part, that is rest. Then we are giving icing in that ice pack and wrapping around the part. Then we are doing compression with the crab bandage. So we are wrapping that part, and we are trying to reduce the swelling from that part. And last part is the elevation. to reduce the blood flow, extra blood flow in that part. So that is a compression. So once the player is injured, so we have to, if that is beyond our limitations, so we are referring that player to the clinic, that is Fowler Kennedy Clinic in our college. So for that we need to fill the incident report form. In that incident report form, we have student section. In that student section, we have subheadings like A, B, D, F, G, and I section. So when it is done, so player has to sign it, and then the trainers give it to the manager in the athletic departments, and then they refer it to the Fowler Kennedy Clinic. So once they get the appointment, the player has to go to the clinic and get their treatment over there.
In the gymnasium, and one of our staff members have to go out and treat it and take a look at what's going on. Obviously, we want to look at your first aid, your ABCs, make sure things are okay. Most of the time in the gymnasium, we have soft tissue injuries such as a sprain or a sprain or whatever, right? So obviously, you want to get a bit of a history on it if you've gone through sports injuries and that, and then you want to, just kind of observe what's going on with the site. Maybe you see some lumps, bumps, bones sticking out. That usually gives you some indication. And then you want to look at functionality, see how much movement they have, if they have any movement, and that. Can they weight bear, non-weight bear? And then you sort of make your decision from there. Every student is different when it comes to injuries. Pain thresholds are different, so you really have to sort of kind of watch it, because a person screaming like crazy and he's got a sliver. So yeah, you really have to look to see what the injury really is, and a lot of times it can be from palpating to doing certain functional tests that might be the difference. The other thing that we usually indicate if it's an acute injury is they should probably have it looked at either by the Fowler Kennedy Clinic or go to a hospital, especially if it's bone related.
So who is the person that is responsible when it happens on the field?
If it happens in the gymnasium, it is one of our staff members. Okay. If it's an event that's being put on by the fitness center, it's one of the people in the fitness center. Okay, that would look after. If it is a sporting event, we usually have student trainers, such as yourselves, that would be helping out with things like that. But if it's during the day, if an injury occurs in the gymnasium, then one of our staff members will go in there.
All right.
How's
Thank
that?
you so much.
Got the video. Thanks for your help. So as an intramural sports officer, like what role do you play when there's an event going on, for instance, in a gymnasium? Like if a person is injured, if a player is injured, what is your role in responsibility as a responsible person? What do you do? What are the steps?
Okay, so depending on the extent of injury would tell me what steps I should take. So being at the front counter, I typically am the first person, as they're coming into the gym, they'll stop at the front counter and let us know. So if it's just, a bit of a sprain, then I have somebody grab the ice and I'll go into the gym and get them to fill out the incident report. It's up to me to make sure it's filled out properly and then submit it to the Health and Safety Office.
Sure.
If it's more than that, I tend to kind of delegate the responsibilities. You get ice, you call security.
Oh, okay.
Security, like if it's
Kind of segregate the work to different position and different people.
Yeah, pretty much.
What are the preventary health and
So
safety?
if you were to talk about the preventative and preventative measures, as opposed to something happen on site of the injury, as opposed to giving a first aid or something, how would you rather prevent the injuries from happening?
So we do a health and safety inspection at the beginning of every semester. We kind of go around to the areas to make sure there's no big divots in the baseball diamond or in the football field. We'll go around the gymnasiums and make sure that everything's secure. We enforce the running shoes, indoor running shoes only policy. There's no boots, no bare feet. And then we advise that they warm up before an intramural game and cool off. Should basic stuff, really.
Yeah.
Emergency protocol.
And is there any emergency protocol as such, like where you guys have to follow? Like if something happens all of a sudden,
There's college
access
protocol.
for information happens.
Yeah.
So
Yeah, there's a college protocol. So if something does happen, I mean, we should be calling security first, and it's their job to call 911. They'll meet the EMS at the entryways and kind of escort them. We're not supposed to just call them ourselves. So there's college protocol that we are supposed to follow. Yeah.
Thanks so much for your time.
You're welcome. Great.